Well, women in New York may soon notice a change when they get a mammogram.
The state now becomes the fourth in the country to pass a new law requiring providers to tell patients about a common but ambiguous problem. Dr. Sapna Parikh here now to explain. Sapna?
That problem is dense breast tissue. It's completely normal, especially in younger women, but it can obscure your mammogram and make it less accurate. So now for the first time, you'll be told if this applies to you.
Just the way you are.
On mammograms, cancer usually shows up as a brighter white area. But in some women, the breast tissue is naturally more dense. It all looks white, making it harder to detect cancer.
Those women have breasts that are higher in connective tissue and fiber structure.
Breast surgeon Dr. Rachel Wellner shows how that limits what doctors can see. This patient was known to have cancer. The tumor can be seen on the ultrasound, but not on the mammogram.
So you could see that that mass was not picked up. You can't see it through that dense breast tissue.
Now, a new law in New York State requires that you be informed if you're at risk. It says that women found to have dense breasts on a mammogram must be given that information in plain language. You can then take that information and talk to your doctor to see whether or not you need additional testing that may pick up a cancer that was missed. Depending on your risk factors, that additional testing may include an ultrasound or MRI of the breast. Dr. Wellner says it's still important for women to get mammograms, but to understand the limitations. She says the new law is a step in the right direction for women.
It's important that she be aware of it and therefore might be able to advocate for herself for any additional ancillary studies that might be beneficial.
And the law goes into effect by the end of January. Connecticut already has an existing law just like this, and there's pending legislation in Congress that would make it a national law if it's passed. And if you go to our website, we actually have information on what you'll see on your mammogram. It's basically, it'll say your mammogram's normal, but you have dense breast tissue, so you need to talk to your doctor. You may need further testing. But it's just information that you know, for women to know.
It is remarkable that New York is just the fourth state to have done this.
I know.
And it should be done in lots of other places
done normally,
too.
yeah.
Exactly.
All right.
All right.